First, I'll measure an MCP extension. You place the patient in a chair sitting right next to the plinth with their forearm in neutral position resting on the ulnar border. You flex the fingers except the one you're measuring. The axis of rotation goes on the MCP joint on the volar surface or the palmar surface. You can see the crease right there. The stationary arm is midline of the metacarpal of the finger you're measuring. The moving arm is midline of the proximal phalanx. You bring out the finger and take the measurement. The compensation is when they start to move their other fingers. Normal for this measurement is 30 degrees. Next is MCP abduction. With the patient sitting down again, have the forearm and palm flat on the plinth. All fingers move away from the third finger. The third finger moves laterally. The axis of rotation is the MCP joint on the dorsal surface. The stationary arm is the metacarpal of that finger, and the moving arm is the proximal phalanx of that finger. Abduct the finger. Do not overlap fingers if it gets in the way. Normal measurement for this motion is 25 degrees. Next is MCP adduction. As with abduction, the forearm and palmar surface are flat on the plinth. The fingers adduct toward the third finger. The third finger adducts medially. As with abduction, the axis of rotation is the MCP joint. The stationary arm is the metacarpal of that finger, and the moving arm is the proximal phalanx of that finger. Move the fingers out of the way, adduct, and take the measurement. There is no normal for this measurement. The last measurement is PIP flexion. The patient sitting down next to the plinth again, forearm in neutral position on the ulnar border, the finger you're measuring extended. The axis of rotation is the dorsal PIP. The stationary arm is the proximal phalanx, and the moving arm is the middle phalanx. Bend the finger. The axis of rotation will move a little, but make sure the stationary arm and the moving arm are flat on the middle and proximal phalanx. The normal measurement for this is 110 degrees.